Hello, Kohawk parents and families. My name is Madison Doctor. I'm the Parent Programs Coordinator here at College. Today we are talking a little bit about health and safety for your student while they're at Co. And I've gathered some of my colleagues to help me discuss that topic. So I'll have them all introduce themselves, say a little bit about their role and what they do here at Co. Paula, do you want to get us started?
Yeah, my name's Paula O'Loughlin. I'm the provost and interim dean of students right now. And as interim dean of students, I oversee everybody in the student life and student affairs area. So you could come talk to me about just about any questions in the areas outside of the classroom in my student life role.
I'll go next.
Yeah.
Yeah. My name is Emily Barnard. I'm the Director of Health and Wellness at Co. And welcome to the Kohawk family, first and foremost. I'm also a licensed counselor in the state of Iowa. So I do provide some individual counseling and group counseling sessions for students. And so can provide those support and resources. And then I also work and coordinate with a number of other colleagues under our umbrella of health and wellness. Our health services office, which my colleague Julie will introduce herself and tell you a little bit more specifically here in a minute. And then also our mental health and counseling services, as well as some of our wellness initiatives, which could include some mindfulness and meditation and yoga. And so basically we're here to support your Kohawk if they need, depending on where they're at, and also provide any resources and referrals when needed.
Carlos, you're up next, but I think we lost your video again.
Yeah, can you hear me still?
Yep, we can.
Okay. Yeah, unfortunately we lost.
That's okay. Want to introduce yourself?
My name is Carlos Velez. I am the director here at College. I apologize for no video. I'm having technical difficulties. My department handles most of the access control, the first responding to students calling in for issues, especially overnight, security rounds, and anything to do with safety and security on campus.
Great. Julie?
Hello, my name is Julie Mueller, and I am a registered nurse here at College, as well as the Assistant Director of Health Services. I was excited to join the Co team last July and have enjoyed promoting health and wellness here at Co. Health Services is conveniently located across from Lower Gage, just under the pub grill. We're available for appointments Monday through Friday, 9 to 12 and 1 to 4. And we are not open on the weekends, holidays, and breaks.
Awesome. Thank you so much. So yeah, just to get us started, I know each of you kind of touched on this a little bit, but what are the ways that our Kohawk students normally interact with you or your office or the resources that you provide?
So I can start. The way students will often interact with me are, I should have added this piece too, I'm the interim Title IX coordinator as well. So students will interact with me if they have concerns about not knowing who to talk to about a particular thing. So if they had a question and they might not know if Carlos and safety and security covers it, or Res Life or something like that. More broadly, I think students talk to me when they are just trying to figure out how to fit in, or they have concerns about getting connected with other students. So I'm lonely, I don't know what student groups to meet with. How do I manage my my roommate situation? That kind of question.
I'll go next. So oftentimes I interact with students in a variety of ways. Many times students may reach out to me or my colleague Malia, which I did not introduce in the introduction. So Co does have 2 full-time counselors on campus that can meet individually with students, as well as a number of community partners that we can provide referrals for mental health resources. So if your student's coming to us with some of those providers already in place, or you think it might be beneficial, or they think it might be beneficial, that's something we really encourage, getting that support network set up from the get-go. I think it can be really tricky oftentimes with transfer students who we know have had at least one semester of college under their belt, or maybe some of your students took a gap semester. But oftentimes they really want to show that independence. And so, which is great. That's what we're here to help them with and to help them grow into more of that independence. But we also want them to know where they can go for support and resources and when if they need it. So oftentimes students may reach out to me if they're feeling overwhelmed or struggling. I am one of the confidential resources on campus. Sometimes I may have friends or parents or loved ones reach out to say, hey, I'm worried about my student. This is what I'm hearing, or this is what I'm seeing. Of course, I'm always going to encourage student and family to communicate, but more than willing to check in on your student. Sometimes am asked anonymously, but I do like to be transparent, just know that from the get-go. So other times friends may reach out. We do also have a number of faculty, because we are such a small campus and community that really take care of one another, also may reach out in the same capacity. So I'm kind of a connector of all things, and here to support in many different ways.
I will go next. Students often interact with security officers because we open up the campus during the day for use. We lock up the campus in the evening. If there's any extra access they need for, special studying group or study time, that's something they would contact us for to get access to the areas they need to. If there's any issues regarding their rooms, if they've lost their key or forgot their key somewhere, we would help with that as well. We are also the only department that is here 24/7 all the time. So even if the college is closed or if there's inclement weather or something going on, security is still here to be reached at all times. We can direct any issues to the department it needs to be directed, but we are always the one to respond first. We are also the ones to call if there is anything suspicious they see, if they have any concerns, and we generally patrol around the campus as well. So if we come across students, we'll say, hello, how are you doing? Things like that. So if anything is going on that they need at that time as well, they're able to contact us. They're able to reach us through the phone that's on all officers 24 hours a day. There is also a security concern tab on where they would go on their MyCo page if there's any issues that they just want to bring up to security as far as they were concerned about or they had an idea, and I'm always available for those as well. One of the things we also do on campus is parking control. So we issue permits to students for their cars. So if you have a car coming into campus, we need to work with them to get them a permit to make it allowed for them to park on campus. We also do ticketing enforcement for that as well. So we're kind of all over the place at all times and always available to be reached. So we're the constant on campus all the time.
For health services, students typically reach out to us for a variety of reasons. Maybe they are having symptoms of a common cold, or maybe urinary tract symptoms, or ear pain, or stomach upset, potential sprains or fractures, or maybe even they might reach out to us for depression or anxiety symptoms. So for a variety of reasons. I also wanted to mention too, health services is staffed 1 day a week by a nurse practitioner. Her name is Lindsay Sheedick. She is wonderful with the students, and she can provide diagnoses of medical conditions, prescriptions for medications when appropriate, referrals for counseling and medical needs too. So.
Awesome. Thank you, everyone. Something that Emily alluded to in what she was saying is that sometimes parents will reach out if they're having a concern for their students, health and wellness. So kind of generally, how can parents support their students or maybe give them that little nudge if they feel like there's a resource that they need to be reaching out to, or they maybe need to seek services from health and wellness? That's a question for everybody, but just as an example.
So one of the ways is to understand that students, my experience, and I'm also the provost, so one of the ways is to understand that academics and student life are connected, very connected, not just in my being, but they're connected at a small college like Co. And so to understand that things that happen in one part will affect the other part of the students' lives, and also to let the students, there is a tendency as to sort of try to fix things for students often, and letting students and encouraging students to reach out to their advisor or to me or to anyone, student life or a professor, is just what the students need to be able to do. And I should also add, what I didn't say is that I have office hours every week that are shared with students, and they're welcome to come see me or others on our team at any point, and we can answer questions for them. So I'm often in the provost office, but I can be over in the student life office as well. So I think the most important thing is to encourage the student to, well, did you talk to someone on campus? Did you try to address it yourself? And to understand that it's a growing process.
Yeah, to tack on a little bit what Paula was going to say, that's exactly in line. You know, every student comes to us with different backgrounds and different ways of doing things. And I often speak with students and really everyone when I talk about health and wellness and well-being on a continuum, because everyone's in a different space and everyone has had different experiences. And so it can be really, really hard to watch your students struggle. Or to be stressed. And especially, I think there's a lot of natural instinct as a parent to want to jump in and fix things for them. And so I think one of the best pieces of advice that I give to parents as far as supporting their student is, you know, checking in with them and asking more questions than making statements. And that's really, really hard. And again, everyone's on a different continuum with this, but that'll allow them some of that autonomy and giving them room to grow. And we also want to, as Paula talked about, we want them to be able to advocate for themselves, both in the academic world, but also for health and wellness. Oftentimes, and again, depending on family experiences, the first person they're going to call is mom or dad when they have a stomach ache or when they're not doing well. And so, which is great, and we want them to have that family support, but we also want them to know what questions they should be asking. And where they can go for that support versus mom or dad calling in to the nurse to say, hey, this is what my student's feeling. We, of course, love to talk to you, but we really want to hear from your student. And so I think asking them those questions and helping them navigate so they can find those solutions will help them in the longer term.
I want to jump in and say, from a security aspect, we are available for wellness checks on students from parents that are concerned about their student not contacting them or possibly not being at areas that they're supposed to be scheduled to be at. But I do also want to warn parents that this is the first time your student is going out on their own and learning a new schedule. So they might break away from normal communication. It's perfectly normal. It happens to all students every year. That's not to say that we are not going to follow through on any concerns you have. We will do so. We will go check. But more times than not, we find a student in their room who just hasn't had the time to contact their parent. And we just tell them to give you a call, and they do that. So just to let you know.
Yeah, that's a great point, Carlos. And I'll just add on to that real quick. You might oftentimes, especially early on or around certain times of the year, you know, whether it be a breakup with a significant other or finals or midterms, or kind of that first round of tests, you're going to get a distressing text or a distressing call from your students. And then sometimes they forget, 10 minutes later because someone has knocked on their door, a friend has contacted them to go study or to get outside and go for a run. And then sometimes they forget to get back to you. So the message that you have is that they're in dire distress. And so I think being able to check in with them first and foremost. Of course, if there are imminent safety concerns, as Carlos said, we will be absolutely following up on that because safety and health are number one. But the other side of that is whether your student tells you or not, a lot of them are really worried about things going on at home. And so I think that goes both ways, you know, certainly being able to communicate with your student about things going on at home. But also not leaving them those distressing voicemails because they do worry about you and family members and things going on at home. So just, again, finding that middle ground wherever that is on your continuum.
I'll jump in here. One of the more important things you as a parent can do to ensure your student is ready to utilize health services is to ask them if they've completed their health packet on CO's website. The packet contains forms that are necessary for us to better understand your student's health should they need to use our services. Immunization forms are required and should have been completed and turned in at this time. If you have further questions on any of the forms, please reach out to me and I'll be happy to help. Also, encourage your student to navigate MyCo so they understand how to make an appointment in health services if they would need to do that. And discuss with your child insurance. Are they covered under your insurance? Can you get them a copy of your insurance card? If you're coming from out of state, maybe investigate what providers here in the Cedar Rapids area would be covered. If they need to be referred out for something that we can't help them with here in the clinic, that's one of the first questions I ask them is, do you have insurance? It's going to determine where I refer them to go to. So that's an important thing to talk with them about. Lastly, maybe just a conversation about taking care of themselves, getting enough sleep, good nutrition. Their immune system is their first line of defense against illness, and that is more important now than ever. So.
All excellent advice. Forgot to unmute myself there. Don't have to do that during a normal panel. Something that Julie alluded to a little bit, it's kind of the elephant in the room here, is obviously what we're going through with new policies and new initiatives to deal with COVID-19. So what has changed? What's different on campus? Obviously, I probably think we could talk about this for another 40 minutes, but what are we doing differently to help keep our Kohawks safe and healthy this year?
I feel like Emily can say more than any one of us. I'll just say that there are processes in place for student groups and in the classroom. There is a strong effort to make sure that we follow the CDC guidelines regarding social distancing, etc. When students or other members of the community don't follow those guidelines, there are repercussions for them in terms of the conduct system. So we take it very seriously that we're part of a community and we're responsible for each other within the community. So I'm going to stop there. There's just so much that we're doing, and I think Emily can probably start us down that path.
Yeah, obviously, I think as you both said, I mean, we could have hours of discussion on this topic alone. And so I think one of the best ways to get you started, if you have some specific questions or even just want a general overview greater than what Paula and I and anyone else that has anything to add, we do have a couple areas on our CO website. We have a COVID-19 tab on the main CO webpage under the www.co.edu. And then there's also a tab called the Safe Campus Initiatives. And that's exactly what Madison just led into is, I believe it's Paula 35 some page document of all of our policies and protocols that we have implemented since the pandemic began. And really the primary focus is we know that students and faculty and staff are going to have illness symptoms. We know they're going to have regular illness symptoms, and we know that there's going to be some that are exposed to COVID and contract COVID. And so that whole document really details our mitigation strategies, our approaches. Obviously, I think we're all virtual right now. So that's one of the biggest things. A lot of our, until we have a greater chance of some vaccines and some, as more research becomes available from the CDC, a lot of us are working remote, but I want you to know that we are still here for your students. And I think students have adapted very well in knowing how to continue accessing resources and support. So things do look different on campus. I think the one thing that remains is our students want to be here. They love CO. They, as last spring, as things were all very, very new. And I know we know a lot more than we did last February at this time or last January at this time. Our students didn't want to go home. So I think that speaks volumes for our campus as a whole and our students as a whole, is they want to be here. And so we're trying to make things as safe as possible for them so that they can be here and enjoy that college experience.
Yeah, those two resources that Emily referenced, the COVID-19 page and then the Safe Campus Initiative, has everything that we wouldn't be able to say, word for word on this call here. So definitely take some time to check those out. If parents want to know more from you or know more about the services of the office that you work in, what's the best way to find that information or to reach you?
That's a question. I would say that you can go to the Dean of Students website and you can go to the Provost website, or you can email me at dos@co.edu or provost@co.edu. And I respond to emails and all the time. So.
Yeah, I think right now the best way to get a hold of me is via email. And my personal email is ebarnard, BARNARD @coe.edu. And again, my information and a lot of the resources that we have available are all located on our website as well. So it's pretty accessible for everyone to find.
As far as security goes, this is where I alluded to earlier that we're always here and always available for contact. So there's a phone number you should learn, and then you should have your students put it in their phone as well. That's 319-399-8888. You will always reach a security guard through those numbers. Also, you can contact us via email at campussecurity@co.edu. Our offices are located in Upper Gage, so we're above the CAF. We're near the mailroom. We're in the areas that all the students go to or focus around during the day, so we're easily accessible there as well. And the tab on the MyCo page does security concerns. We can be reached through that as well.
And I can be reached at my personal, or excuse me, not my personal email, but the old healthservices@co.edu is the email to the health services office. You can also reach me at my co-email, which would be jmueller, MUELLER, @co.edu. You can call me here in health services at 399-8617. If your students are here on campus or arriving soon and they have questions for me, they're welcome to come to the health services door. They can knock on it because things look differently because of COVID. The door is locked right now. We are doing appointments only. And I just wanted to talk a little bit about that as well. We are doing a lot of telehealth, and we are not seeing any respiratory signs or symptoms in the health clinic right now. If they are having those symptoms, they are pretty much all the COVID symptoms as well. So we are referring them to that covid@co.edu email and referring out for potential COVID testing and that sort of thing. But again, we are doing lots of telehealth visits. We are still doing some face-to-face if we can rule out that any of the symptoms they're having are COVID symptoms. So that's kind of how things look different here in health services as it relates to COVID too.
Madison, do you want to share about the live Q&A Zoom we're doing next week?
Yes, I would love to do that. So all parents and families, co-community members are invited to participate in a webinar that we're holding next Tuesday, January 19th at 7 p.m. Central. We'll have representatives from Residence Life, the Dean of Students, Health and Wellness. I think at least 3 of us on this call right now will be there. And we'll be there to answer some basic questions, address some basic questions about, reopening for the spring, but then also just providing some time for parents and families to ask direct questions of us if they have any, concerns or questions about the return to campus, the testing procedures that all of our students will be going through when they arrive in a week and maybe a couple days. Yeah, the spring term is descending upon us quickly. So yeah, we would love to see as many parents there as possible. So again, that's Tuesday, the 19th at 7 p.m. Central. Yeah, any other last information or words of advice for our Kohawk parents and families?
Don't be afraid to reach out, to ask us questions, but more importantly, again, encourage your students to come to see us, to reach out, to call us, to bop by, to text us, whatever. We want to be there for them. We are here for them, even in this pandemic.
Yeah, just to echo that, you know, encourage your students to reach out, especially if they're coming to us with some health concerns or a health history. You know, it's helpful for Julie and our staff to just have that information so that if there's we need to respond, or so that we can give them the best advice possible to get that medical care as soon as possible if that would happen. I do want to mention, and I think most families or most are aware, but we are located right in the Med Quarter in Cedar Rapids. And so we are so lucky to have two major hospitals and a number of clinics and offices within walking distance for students. So we're really lucky to be really conveniently situated. So even if, because our health services is not 24/7 in the clinic, there's a number of resources that students can walk across the street and still get access to care.
Also remind them that though security does patrol and enforce policies, we are not the boogeymen. We are here for their safety and security, and we'll always listen to any concern they have. Please come and talk to us at any time for anything that we can direct or help ourselves.
Yep, and I'll just agree with all of that. We are here, I'm here, I'm happy to answer any questions. And if I don't know the answer, I'm happy to investigate who we need to contact to answer that. So yeah, contact me and ask any questions you have.
Wonderful. Yeah, as Emily had mentioned before, we're a small campus. We all know each other. We're very easily, you know, accessible and able to reference your student where they need to be. So don't hesitate to reach out. Thank you all for being here with me today and for chatting a little bit with our parents and families. Have a great rest of your day.
Thank you.
Thanks.